Well, joining me now on the line is Tony Stein, who's the CEO of Healthcare Management Solutions. They run about 70 different care homes across the UK, including the Patcham Nursing Home in Brighton. A very good morning to you, Tony.
Good morning. How are you doing?
Thanks for joining us. I'm glad you're here because I just kind of want to stress, this isn't about us bashing care homes, not at all, because we know that you have really been through it over the past 18, 19, I think we're now on 20 months, aren't we? And the
Mm.
rules and regulations keep changing all the time. And ultimately, you just want to keep your residents safe. I get that. But it's so hard when you hear, like we have this morning, from those friends and family who are unable to see their loved ones, and they're talking about how it's had a real impact on their their loved ones' mental health.
Yes, I mean, coronavirus has had a dreadful impact on many people, and that's an inevitable consequence, I think, of a pandemic. I mean, people are going to find that they're separated from their loved ones when lockdowns and isolating people is the methodology that we use for trying to control the spread of the virus. It's inevitable. I mean, we found across the country that genuinely the vast majority, or almost every one of our relatives, has concluded that actually we've handled this as well as we could possibly handle it, and they've been very pleased with the way that we've dealt with it. And visiting is slowly but surely getting back to normal. This essential caregivers issue is an unusual one, though. Um, Vicky and the team at Patcham have one relative who has been nominated an essential caregiver. That lady used to look after her mum daily until she could no longer meet her mum's needs, and she came to join us at Patcham. And she became an essential caregiver, and she comes and visits every single day, and she sits with her mum and reads to her and so on. Um, it's not a free pass to come and go as you please, because you have to be treated just like every other member of staff and go through the same testing and wear PPE and so on. And but we recognise that in certain circumstances this is essential for the mental well-being as well as the physical well-being of the individuals in our care.
Yeah.
And
Let me
the reason why, if I can just say that the reason why this is not mandated and that not voluntary, but it's guidance for operators is operators of care homes have a statutory duty of care for the residents that they look after, and we have to keep them safe. It's our statutory duty. And so we have to make choices based on risk assessments. I'm quite distressed to hear some of the stories that you played earlier. That's not our experience of our relatives, I have to say.
Yeah. That seems to be the thing, though. It seems to be a bit patchy. Some people saying, like you just said, some care homes have managed, it's really well, considering that the circumstances in which they found themselves. Others less so. Angela from Lewis has just got in touch. Let me read you this, Tony. She says,
Mm,
surely these elderly people have a right to see their relatives. If everyone has been tested before they come in, then what's the problem? So I'm not being funny, but relatives will have real grief issues if their elderly family member dies before they get to see them. And I
mm.
presume that prison care homes are testing their staff. Sorry, at present, care homes are testing their staff every day. I can fully understand if there is an outbreak and visiting is suspended. I should imagine, though, that these elderly folk would prefer not to be living if they can't have that contact with their loved ones. I mean, testing surely is the answer, isn't it, for these care homes that are restricting visitors? No?
Yes, and testing is now more is available to us. I mean, if you remember at the start of the pandemic, we didn't have testing, we didn't have vaccines,
We didn't have
and we had
masks
to
at one
take
point, did you, Tony?
exact. Well, no, we managed it, but thank you. Yes,
Mm.
some homes certainly struggled with their PPE. But we've gone through a journey here, and I think is everybody getting it absolutely right all the time? Probably not. I think for me, the answer's always been to have a full, frank, and open dialogue with our relatives, and to understand what their needs are, but to try and balance that with our duty to protect all of the residents within the care home. So, we did find that there's a little tension sometimes between some relatives who might say, well, look, we want to come in frequently, every single day, and see our loved one, and they don't care if that means that they get coronavirus, and it shortens their life, because they'd rather that than live in isolation. But obviously we have to worry about the other 25 or 30 people that are living in that home as well, and allowing it in is not really an option. So we're sort of treading that very difficult line all the time between managing our statutory duty to protect everyone and yet recognizing the individual needs. So, I've talked about essential care givers. One of them at Patcham, and obviously comes in and out with Vicky and the team there, and is treated almost like one of the staff now, as a regular visitor. But we haven't had a lot of people flooding in.
Would they have to be double vaccinated or triple vaccinated now, as is the case then, as care workers would have to be?
Well, as it turns out, they are, and all of our essential caregivers that have asked to be nominated as such, we've allowed that to happen. They're all double vaccinated. I think people are very sensible generally. It's a dialogue, isn't it? So we would say to a relative who wanted to come in and to take that position, we'd say, well, from our perspective, we would prefer it that if you were doubly vaccinated and you take your booster when it's available, and they have, to a man.
But you can't make them, can you?
We can't force them to.
No, but I can just imagine if you're somebody who was working in the care sector and you've left because you don't want to take the vaccine for whatever reason, you're going to be a bit miffed hearing that other people can go in under this essential caregiver status and don't have to be jabbed.
Yeah, my views on the mandating of the vaccines are pretty well documented. I wish we hadn't done it for many reasons. I think there were ways that we could have handled it with regular testing and PPE. And remember, it was only for existing members of staff or new members of staff who were employed on the basis that they have to be vaccinated.
Right. Did you lose a lot of staff because of it?
Well, strangely enough, out of the 2,000 roughly staff that we have in the English homes, we lost 23.
Right, okay.
Which was a very, very small number. And I wish we hadn't lost them, if I'm honest, because staffing is an issue for us generally, and losing anybody is a loss. But it's more than that. It's actually, this isn't just 23 people who we're going to have to replace, and it's not that easy. These are 23 people who have experience, who we've trained, we've invested in, but more than that, more importantly than that have built really strong relationships with the people they care for, and that's a major loss to them. So to some extent, I wish we hadn't done it. I wish we could have found a different route, but we are where we are, and as an operator of care homes, I have a duty now to ensure that everybody's doubly vaccinated.
Tony, thank you for your time this morning. Tony Stein, they're the CEO of Healthcare Management Solutions. They run about 70 care homes, I think he said, around the UK, including the Patcham Nursing Home in Brighton. Now, we did ask to speak to Gillian Keegan this morning, the MP for Chichester, who is also the Minister for Care, but we were told that she wasn't available. In a statement, the Department for Health and Social Care told us, we are doing everything we can to support care providers to facilitate visits safely, including ensuring all residents can nominate an essential caregiver, removing limits on visitors and reducing the period of time that visit restrictions apply following an outbreak. Our message is clear. All care home residents should be supported to get the care and companionship they need from visitors, as this is essential to their health and well-being. But as we heard from Tony there, it's difficult, isn't it? Because care homes got this statutory right to keep their residents safe. Yes, the government are telling them this, but it's only advice. It's not actually legislation, and that is what campaigners are fighting for.